Doc, give us a sense of where we are. Look, we keep hearing Omicron versus Delta. People, we're seeing cases explode. As I said, I'm sitting here in quarantine right now, testing positive for COVID on Saturday. But pretty
How you
much
feeling?
feeling, still a little stuffy nose, still occasional cough, but that's it. No fever, nothing else, no shortness of breath, none of that. And just getting better by the day. Feels like I feel like when I had allergies. But we are still in an international pandemic facing a crisis because hospitals are being overwhelmed and many of those people are unvaccinated.
First of all, this Omicron wave is like nothing we've seen before in the sense that it is accelerating at a rate we've never seen before. It is the most transmissible of all of the COVID variants by quite a lot, almost as transmissible as measles, maybe as transmissible, which is the most transmissible virus agent we know. And so that's why you're seeing the steep rise, especially in New York and Washington. And now the hospitalizations are picking up in New York and Washington. There's a buzz out there that's saying Omicron may not be as serious as the previous lineages like Delta, et cetera. I don't think that's the case. I think it's probably going to be as serious among the unvaccinated for reasons that we can go into. But we are starting to see hospitalizations in New York and Washington, and it's going to be across the country. That's point one. Almost all of those hospitalizations are going to be among people who've not been vaccinated. The number that's about out there is about 85, 87% of the severe illness and deaths are among the unvaccinated. The others mostly among the partially vaccinated. So we'll see that same pattern again. But here's the second hit we're going to face right now. Because this is so transmissible, and we are seeing that the booster shot is not quite as effective as the other boosters, as was pointed out. It's as effective at preventing death or serious illness, but it's not as effective at preventing symptomatic infection. So the problem that we face, this very unique wave, is that in addition to unvaccinated piling into the hospitals and ICUs, the healthcare workers, a lot of them are going to get breakthrough symptomatic infection even after their booster, which is not going to land them in the hospital, but it's going to keep them at home and out of the workforce. So you're going to see, we've already had a depletion of our healthcare workforce over the last 2 years for a lot of reasons, for attrition and burnout and all of the other factors that we've been hearing about. But on top of that, we're going to knock out an additional big segment of the workforce. And we know that mortality, death rates really climb when hospitals are going to get overwhelmed. And so that's what I'm worried about. It's going to be the unvaccinated piling into hospitals, and there's not going to be enough doctors, nurses, respiratory therapists to take care of them. And you're going to see mortality really start to climb. Two other things, and then I'll stop, which is
sure.
The other thing we're finding is with this highly mutated virus, 2 of the 3 monoclonal antibodies that we have are not working. So we're not going to have as many treatment options. That Paxlovid medicine from Pfizer, forget it. It's not going to be ready in time for this wave. It's going to take months before we have enough of it. So we've got a lot of vulnerabilities, and our only real hope is that we persuade the unvaccinated to start getting vaccinated now, get that vaccination series. Otherwise, we're going to repeat what we've already just experienced. And what we've just experienced, Roland, and you alluded to it, is that since June 1 of this year, over the last 6 months, 200,000 unvaccinated Americans have needlessly lost their lives because they refused COVID vaccines, including the first death that we've had from Omicron last night in Houston, an individual who was infected and recovered, but decided not to get vaccinated on top of it because Omicron can cause reinfections very easily. So that 200,000 number of people who threw their lives away because they refused to get vaccinated over the last 6 months, that number is scheduled to double now, between now and the first quarter of 2022. To 400,000 Americans whose lives could have been saved, but they chose not to get vaccinated. And so that's why I'm here late on a Thursday evening before Christmas to to work with you, Roland, to do whatever we can to get people to get vaccinated.
So, doctor, explain this. Explain this. Why, again, Faraji brought up an example of someone who he knows, or he heard an example of someone who had a side effect as a result of getting the booster. There are people who are afraid to take the vaccines. There are others, the people who have been mocking me, doing videos saying, "Oh, look, here he is out here touting the vaccine, and he got COVID himself." And I keep explaining to people, the vaccine was never designed to prevent someone from actually getting COVID. And so if there's somebody who's sitting here who's saying, "I'm unvaccinated, I'm not doing it, my family's not doing it," just lay out the risks that are involved.
Well, the risk is, as I say, overwhelmingly the people who are dying in this pandemic right now are those who are unvaccinated. So you would take a huge chance to joining to your 200,000 fellow Americans who also refused to get vaccinated and lost their lives since June 1, because I say that number is now projected to double. Here's what happens if you get vaccinated. If you get vaccinated, this Omicron variant is got a lot of escape mutations, which means that the vaccines, it's true, are not as effective against Omicron as they were against Delta and Alpha and other previous variants. So what that means is the vaccines now are still saving your life and still keeping you out of the hospital, but they are not always preventing symptomatic infection. It's about 75% protection against symptomatic infection versus Omicron versus 95% versus the previous lineages. So it's still pretty good, not as good. And that's why, Roland, you had a breakthrough symptomatic infection, but you're talking on a national radio broadcast with a cold rather than intubated in an intensive care unit. That's the effect of the vaccine. And so that's the message. You've got to get vaccinated, and we have to stop this business of saying you've been infected and recovered, you don't need to get vaccinated. That's just one of the phony anti-vaccine talking points. As I said, we just had our first Omicron death from a person who got infected and recovered and chose not to get vaccinated. So that is the reality.
Reese, go right ahead.
I have a comment for Faraji, but I'll save that for another time. For now, I want to ask Dr. Hotez. So I have an 8-month-old, and I am scheduled for travel. And I feel like the messaging is all over the place. I feel like there's more political messaging about, well, if you're vaccinated, you can, go on ahead and enjoy your time with your family. But then I see all of the doctors and epidemiologists and virologists are like, hair on fire. This is a red alarm, crisis. I'm not asking you to give me specific medical advice, but I guess for those that are potentially traveling with unvaccinated children, based on the modeling that you're seeing, what comfort level would you express with traveling with unvaccinated children over the next 2 weeks?
Yeah, we have seen a lot of happy talk come out of Washington, D.C. this week. I was a little surprised by it. When something it's this transmissible, I think there is a pretty good risk if you're going through airports and bus terminals and Uber rides, you're going to be exposed to Omicron. And if I were traveling, and with your baby, who's, you said 8 months old, masking is not really an option. There is risk, and we are seeing pediatric hospitalizations now with this Omicron variant. It was a big problem in South Africa. It was true of the Delta variant here in the South and here in Houston and Texas. Texas Children's Hospitals, which I know Roland knows well, had a lot of pediatric hospital admissions. So I'm not a big fan of traveling with an unvaccinated individual, whether it's because someone's refusing to get vaccinated or because someone's too young to get vaccinated. Let me tell you my own situation at home. So I live in Houston. My oldest daughter lives in LA. She came to see us, and we were going to have my mother-in-law come down. We were going to fly her down from New Jersey and spend a week with us, go to the restaurants, maybe a museum. I disinvited her. And the reason I disinvited her is, in her case, she is fully vaccinated and boosted. But because it's been a while since she got that boost, we know that breakthrough symptomatic illness does go up the further you're out from the boost. And I didn't want to chance it with someone in their 80s because they won't do as well as Roland did with his breakthrough symptomatic illness. So I said, let's not chance it right now. Let's hold off on this for a while. The hope is that this big wave will go down as fast as it's going up. We don't have strong evidence for it, but there is a possibility. And that would be the best possible outcome because now that the kids are out of school, they'll be out of school for a few weeks. By the time they're ready to go back through K through 12 or go back to university or college, hopefully we'll be on the downslope of this big wave. No guarantees, but I think that's one possible scenario.
Thank you.
Faraji?
Thank you so much for joining us. So, Doc, talk to us a little bit about, we're hearing all of these different, you're bringing up information about the effectiveness, the efficacy of this vaccine and booster compared, when it comes to Omicron. But how should people look at all of this stuff? Because again, I'm not into going back and forth about vaccinated, unvaccinated. I stay masked up, and I know people that have stayed masked up, and you can still get it. So I'm talking about assuring people of that this situation that we're dealing with can be handled. Because what I'm seeing right now, Doctor, is that they're saying that the more that vaccines are being developed, that more variants, more mutations may occur. So can you give us some insight about that, sir?
Yeah, that's actually
and Doc, just as because you may not have been on earlier, where Faraji said that he previously got COVID, but he and his family are not vaccinated. So go ahead.
Yeah, no, so this is one of the kind of the fake talking points that's out there, that they make the claim that vaccines are actually inducing the mutations to cause the variants. Here's the reality. The reality was our worst pandemic threats arose out of unvaccinated populations. So the Alpha variant arose out of an unvaccinated population in southern England in 2020. Delta arose out of an unvaccinated population in India at the beginning of 2021. And Omicron arose out of a mostly unvaccinated population in southern Africa, either South Africa or Botswana, towards the end of this year. And that's why we keep getting these variants, because nobody has come up with a plan to vaccinate the southern hemisphere. The African continent has been left almost totally unvaccinated, about 6%. So that's what we do at our labs. We're making low-cost vaccines for parasitic infections and for COVID. We have a low-cost recombinant protein vaccine that we've made with no patents. We transferred the technology now to India, Botswana, Indonesia, and Bangladesh. And the one that's furthest along is the one in India with our partners there known as Biological E. And now it'll be released for emergency use authorization. It's the least expensive of the vaccines out there. And it's the same technology as the hepatitis B vaccine. Very few side effects, looks like the best safety profile. And the Indian government is now has ordered 300 million doses. So we're hoping now that this can come in to prevent all of these new variants from emerging. So that's the problem, is the more we allow large populations to go unvaccinated, we'll continue to chase our tail with these variants.
Thank you, sir.
And we actually, in last year, the doctor, the scientist from North Carolina A&T we had on, that was one of the things that he said. He said, we've got to get as many people tested and vaccinated in order to stem these various mutations. He said, because when it jumps from one body to the next, it's going to start mutating left and right. Greg Carr, any question for Doc?
Thank you, Roland. And thank you, Dean Hotez. You've kind of given part of the answer in responding to Faraji's question about this question of a global pandemic and where nobody is safe. And I read your comments on being against travel bans, and it makes perfect sense. Although I can't imagine that the pharmaceutical companies are very happy with you and your team as you're starting to give away proprietary patent to vaccines, but we must get everybody in the world.
I appreciate that point. As I say, is if we had gotten even 10% of the amount of money Moderna had gotten and some of these others, we could have had the world vaccinated by now, in my opinion.
Absolutely.
But that's a different discussion, I guess, for a different day.
No, actually, well, it is actually leads to my question, and I'm glad that you began the answer with answering for Raji. And my question is this: as an educator and one of my best students, former students, is a doctor, pediatrician in Atlanta, and it's very much what you've said there. She's confirming that what she's seeing in Atlanta. My question is, what do you see happening in the first quarter of 2022 as it relates to schools, K-12, higher ed? Are we looking at another shutdown in this country?
Boy, I sure hope not, because I don't think our kids could handle it. And as a parent of formerly young kids, now they're adults, I know I couldn't have handled it. We've got to get our kids back in school. So I'm really, really hoping that we get this big wave way down, because I don't know that as a nation, we need our kids in schools. If you remember a couple of days ago, the U.S. Surgeon General, Vivek Murthy, I think is an excellent Surgeon General, came out with a report on the mental health impact of this COVID-19 pandemic on our kids. And it's just devastating. And it's not only because of the classroom education, but remember, you all know better this than anyone that in many of our inner city schools, that school's the place where you go get breakfast, or you go get lunch, or you get your mental health counseling. And so the impact of not having kids in school is just multiplied times 4 or 5. So we've got to make that a priority.
All right, so Doc, so here's a question that I have, and again, just trying to understand this. Okay, so my first symptoms showed up last Wednesday. It was a scratchy throat, and then the next day I had chills, had a fever. Tested negative on Thursday, did one of the rapid tests, and then they said the next one would take 36 hours after that. On Saturday, I tested positive. And so I came back. I was in Atlanta. I came back.
By the way, that's a pretty common story. So this is one of the interesting things about Omicron. There seems to be a lag between. So when you're first infected, the PCR is positive, but your antigen test is negative because there's still not enough virus there. And then it comes up after that. So that's actually not surprising. So you had the rapid home test was probably the antigen test that was a false negative because you had the virus. That's not surprising, but the PCR came back positive.
Right. And so then I got home to Virginia on Sunday and went into quarantine. So the 10-day period, is that at the beginning of symptoms or when you test positive? And then how do you know, like what needs to happen for you to come out? So is it complete stuffing is gone? Is it no cough? Or so how do you?
I believe the recommendations are 10 days from your first onset of symptoms, plus you have to be at least 24 hours with no symptoms at all.
Got
it.
You
have to meet those 2 criteria.
Got it. Meaning no cough, no stuffiness, nothing like that.
Right. Now, I mean, I can check it as well, but I mean, it's also a moving goalpost because the CDC just made a change tonight for the healthcare providers, and I have to make certain it doesn't extend to other groups, which is that now they're saying, because we can't afford to have their healthcare workers out of the workforce for 10 days. So now, So in the UK, what they did is now after 7 days, if you test negative, you can go back to work. And I think they require 2 tests. But in the US, they're going to require a single test. So you can go back to work after 7 days. And that just came out literally within the last hour, I think.
Now, what I was told is that even when I come out, I still might test positive for 2 or 3 weeks, but I'm no longer contagious.
Explain that's right, because that PCR test is so sensitive. It's picking up remnants of the virus genome. So even though you're not shedding enough virus to infect people, you might still be positive. And that's the reason why we often recommend not testing again, because you could be testing positive literally for weeks.
So when should I take a test?
You don't. That's unless you start feeling sick again. And then
so the most important thing is that all symptoms are gone, meaning there's no longer a cough, there's no longer slight stuffiness, all that's gone.
Pretty much, yeah. And then you should be good. You don't need to get tested again, because if you get tested again, it creates a lot of confusion. Then you could be positive, but you're positive, you're still not shedding virus, and then yeah, I would just hold off and not test again if you're not having symptoms after 10 days.
So the last point here for you is that for everybody who's watching, who's listening, the advice is that if you are unvaccinated, you're putting yourself and others at serious risk of
hospitalization and death. But Roland, there's one other thing that nobody talks about, which I want to bring up, and that is we don't talk enough about long COVID, where your symptoms linger for sometimes a year in terms of not fever and acute symptoms like a runny nose, but you feel fatigue, you have heart palpitations, you feel tightness in your chest. We're learning a lot about that, and there's a very important study that was published this year out of the United Kingdom. The United Kingdom has a real health system, unlike the U.S., where we have Amazon Pharmacy, and that study, they have 40,000 MRIs on file. Everybody who had an MRI, it's registered in the UK system. This is pre-pandemic, and then they can bring them back now that they've had COVID to compare before and afterwards, and it's showing some pretty frightening stuff like gray matter brain degeneration, and the MRI your brain scan looks like somebody who's 20 years older, associated with cognitive decline. And that's the other piece we don't talk about. It's not only piling into hospitals, into ICUs. This could be with you for years, and especially if you're a young person, you don't want this happening where you've got gray matter brain degeneration and cognitive decline when you're trying to start a family or a new job or taking your SATs or trying to get a mortgage on your house. And so that's going to haunt us for a long time as well. Yet another reason to get vaccinated.
Last question, Doc. The infusion, I did get that. It was the Regeneron when I was in Atlanta. Do you also recommend that if people get a positive COVID test, they're able to find a place that does it, that they get they get that infusion?
Up until 2 weeks ago, I would have said yes, but now the problem is this: with this Omicron variant, that's going to be the overwhelming one. That Regeneron monoclonal antibody probably is not going to do much for you, and neither is the one from Lilly. So that's what I mean. 2 of our monoclonal antibodies have been knocked out in terms of being useful for this Omicron variant, and that only leaves the one from what's known as Vir and GlaxoSmithKline, and there's not a lot of it around. So this is, again, why we need to get vaccinated. We kind of lost one of our major weapons, monoclonal antibodies. We won't have that Paxlovid medicine from Pfizer. So we don't have a lot of, we've lost some really, we've either don't have or have lost some really important tools. It's just a reminder of why you need to get vaccinated. And even if you've been infected and recovered, like our friend that I was speaking to, we need to get that person vaccinated, because that's the only way to really prevent Omicron reinfection and prevent all of the things that we're talking about.
Gotcha. So this is the last question. So you just said that. So first of all, I've taken a PCR, so I don't know if I got Omicron or what is it. It's just simply assumption.
Yeah, the PCR won't tell you. It's a specialty kind of genomic testing that they're not doing it on everybody. But.
So now that I've had this, can you get Omicron again?
Probably won't get Omicron again, but you may want to get another booster down the line, depending on how things go. They haven't come out with that recommendation yet.
Well, I can't. Well, because I got the infusion, I can't do a booster for 90 days.
For 90 days, that's
so
right.
I have to wait until March.
Right, that's right.
But trust me, when March hits, I will be getting a booster.
So let's just go through a few brief scenarios. If you're unvaccinated at all, you're asking for trouble. Get your vaccine series. If you've gotten 2 doses of either the Pfizer or Moderna vaccine, get that booster, because that booster can make the difference between going to the hospital or not. If you are infected and recovered and you've not gotten vaccinated, get vaccinated. If I'm starting to sound like a broken record here, it's deliberate. It's get vaccinated, get vaccinated, get vaccinated. And by the way, if your kids are 5 and up, get them vaccinated too. So we're doing a terrible job vaccinating our kids.
All right. Doc, we certainly appreciate you coming on again. Dr. Peter Hotez, co-director of the Center for Vaccine Development at the Great Texas Children's Hospital in Houston. Thanks a lot.
Thank you, Roland. I know you come to Houston a lot, and you're not visiting me. So once this apocalypse is over, I want to show you around our labs how we're making vaccines for COVID and show you all the changes that have happened over our Great Texas.
Oh, no, that'll absolutely happen. I was home I was in Houston for Thanksgiving, and I was planning to go home to Houston, Dallas. My parents live in my home there for Christmas, but I got diagnosed, and then my sister did, who lives there. So I said, well, heck, if I didn't, I wouldn't be able to go back home. Would go home anyway. So
right. Well, the other reason is I want to give you a big hug because you've been one of the really strong voices in the African American community that has really, pushed for science-driven, evidence-based COVID prevention measures, and you're worth your weight in gold. You're just a great man.
I appreciate it, and trust me, I will be coming back home to H-Town real soon. Doc, I appreciate it. Thanks a lot.
Thank you. Bye-bye.
Bye, everybody.
All right. Back to our Roland Martin unfiltered video in just one moment.
Time to be smart.
Roland Martin's doing this every day.
Oh, no punches!
Thank you, Roland Martin, for always giving voice to the issues.
Look for Roland Martin in the whirlwind, to quote Marcus Garvey again.
The video looks phenomenal, so I'm really excited to see it on my big screen.
Support this man, Black Media. He makes sure that our stories are told.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
I got to defer to the brilliance of Dr. Carr and to the brilliance of the Black Star Network.
I am rolling with Roland all the way.
Honored to be on a show that you own. A black man owns the show.
Folks, Black Star Network is here.
I'm real revolutionary right now. Roland was amazing on there.
Stay black. I love y'all.
I can't commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having.
Let's be smart. Bring your eyeballs home.
You can't be Black-owned media and be scared. You dig?